Morning, morning, everybody.
Good morning.
Good morning. Happy to see all y'all here. Having a little trouble here. My computer decided it was a good time to turn itself off a while ago. So I went into panic mode searching for my other computer. One of those days already. Okay, we're missing a few people this morning. What's going on with that? Let's see. Morning, Jeff.
Morning, Linda. How are you?
I'm good, thank you. I'm waiting for a few stragglers to come in, and
Sure.
thank you so much for coming. We're all excited.
Well, it's my pleasure. I'm happy to do this.
Your program just tickles me. I love your program. I'm a statistician at heart anyway. That's what my minor is in my program, and so I don't get a chance to work with numbers as much. So I always like to see what you have bring to the table.
Great. Well, I appreciate that. We're constantly innovating and coming up with new stuff. So I can't wait to show you the next version.
Yeah, I'm really excited. It's just so neat. I think about all that data and it gets me all excited. I don't know what this says about my life, but
Yeah.
So if we give everybody maybe one more minute and then I'll just let people in as they usually this group is here on time. I'm a little surprised they're dragging. I think the time change has done a lot of people in, including me.
Yeah, definitely. It's definitely had an impact for sure.
Yeah, I was taking my kids to school to the bus, my grandkids to the bus this morning, and I've never been late. And I had to pull them right up next. I said, "Y'all just get out and run." And my daughter would kill me. She is like so organized. She's so not my child.
Yeah, sounds like my daughter.
uh,
You know what's worse though is when you have to spring ahead.
oh
You
yeah, that's much worse.
Yeah, that's way
Yeah,
worse.
yeah. This one hadn't been so bad. My grandkids are 8 and 10. These two, and they were actually up an hour early.
There you go.
So so yeah, but yeah, it was I was in panic mode because I haven't ever taken them all the way to school. I don't even know what school is. We'd have been on a hunt.
Yeah, no kidding. Wow.
Oh Lord. So anyway, well, we've got most of our people are here now. We're just missing a few, and I'll just let them in. If you want to, we'll get you started here.
Sure.
Let me just give you a little bit of an introduction. Okay, class, this is Jeff Pratt, and he has this great big data program he's going to talk to you all about, and that many of you will have the opportunity to use when you're in your, I think it's one of the graduate class, one of the stat classes for undergrads. And then also when you get out in the working world, you may be fortunate. 416, thank you, Shayla. You may be, you most likely be able to use the real thing, once you get out in the working world, especially those of you that are specializing in data analytics. So, okay, I'm going to turn it over to you. Oh, Miss Shayla is telling us she's using your stuff already.
That's fantastic. Where do you use it? Here at CSULB or at one of the hospitals?
Shayla? For CSULB.
Oh, okay, great.
Yeah, it was one of our assignments that we had to do.
Excellent. Yeah, well, hopefully as you guys get out into the working world, it certainly through at any hospital in California, a lot of them are using it now. But a little bit about SpeedTrack. We're a software technology company, and we're very different than other softwares. We've patented several solutions. And without getting technical, the big difference between us is everybody else focuses on data and how do you store data in a database so you can query the data So then you can get information out of the data. The problem with that approach is you have to know what you're looking for. And so what SpeedTrack has done is, rather than focusing on data and how to store it, we came up with a methodology that extracts all the information from the data, and we actually store the information. And I know that sounds like, well, what's the difference between information and data? If I say to you 92646, it's just a number. You don't have any context with it. But if I say 124 Main Street in California, zip code 92646, all of a sudden has context. You know it's an address. What SpeedTrack does is we store all the associations between all the data elements. So if I say 65 years old, you know we're talking about somebody that's 65 years old. But if you know that X% of the population that's 65 years old is male, and 10% of those 65-year-old males have hypertension, and 10% of them have cardiac heart disease, you know, then all of a sudden it starts becoming information. And that's exactly what I'm going to show you here with SpeedTrack. I think it'll click with you because it's really intuitive. You don't have to be a technologist to use it. You just have to know how to click a mouse. So, by the way, so what class is this, Linda, before I get into some details?
It's marketing. It's
Okay,
marketing.
perfect. Okay, so I'll come at it from kind of a marketing perspective, and feel free to ask questions. And if Linda, if you can keep an eye on folks that want to ask questions and interrupt me at any time as we go through this, that would be great. So let me
Super.
share my screen. Oh, you need to let me share my screen.
Oh, okay. I'm sorry.
That's all
All right,
right.
there you go.
Okay, let's see.
I have a new version. My Zoom quit working, and they uploaded some kind. Best Buy did, not CSULP, and so it's got all these bells and whistles that I forget.
Yeah, I know. These things drive me crazy. It's you know, everybody uses a different type of video meeting, and I prefer Zoom because it's
Me too.
easier to use, but you have to be good at all of them. So can you see my screen?
We can.
Okay, so this is just the SpeedTrack website. I'm not going to dally on that. Let me click on the actual application. Can you see that?
Yes, we can. Yes.
Okay, so what you're looking at here, and this is just for CSULB, is we have the start page, and it just reminds everybody that the data that you have access to isn't real private health information. It's information that we synthesized for HIPAA reasons. So obviously, we're not going to provide students with access to who got what kind of surgery, where, and when. So we just want to put that notification in here. Now, having said that, I'm going to go ahead and click on the first tab. And we do show actual hospital names because those are public information, and we're trying to make this as real as possible for the students. So you can see actual hospital names, but the data for the hospitals is completely synthesized. It doesn't relate to any actual patients. So with that in mind, let me kind of walk through what it is you're looking at. The way we organize this is obviously we have these different tabs down here, and each tab contains what we call categories. So in the facilities and payers tab, you can see that we can show the facility county. And so here's all the counties in California, and they're listed in descending order of the number of inpatient encounters for each county. And then likewise for the hospital systems, here's the systems, and you'll notice in the upper left-hand corner, it indicates the number. So there's 211 hospital systems in California, and there's 494 different individual hospitals. And then as I scroll down, we have payer information, or the type of insurance that patients have. And you can see here's the principal payer categories over here: Medicare, Medi-Cal, there's private commercial coverage. And as we go across, you can see whether it's managed care for an HMO program or other types of managed care programs like PPOs, our traditional coverage, which is fee for service. And if it's an HMO payer plan, here's the actual payer plans associated with them. And before I go any further, I just want to point out, if you look up here in the upper right-hand corner, you can see this number, 87,534,000. That's the number of patient encounters you're currently looking at in the system. And you'll see this number change as we explore the information in the data. And one way to think of it is everybody's used to using GPS navigation for figuring out where to go, for mapping things. Essentially, what we've done is we've created a GPS navigation system for your information space. Excuse me. So the information space in this case is all the hospital encounters for hospitals throughout California. And I'll click on the year drop down up here. And we're currently looking at, in this application, 2018 through 2022. We're going to be updating this in the next couple months with 2023 data. Again, it's all synthesized. But this data, during the synthesization process, we actually follow, from a statistical perspective, all the trends that actually occur in California. So in terms of the types of diseases, where they're occurring, the race ethnicity profiles, the types of insurance they have. From a statistical perspective, the distributions actually follow the real data from the state of California. So you'll get a very realistic experience. So again, keep in mind that this is like a navigation system for your information space. And before I get into an actual use case, I just want to click on a few of these tabs. You can see this is the patient dashboard. It's showing where the patients live by zip code, the race and ethnicity breakdown for each zip code, the cities, the counties. Record linkage numbers are something unique. They actually indicate a unique identifier for the patients. So this person here has had 2,172 encounters at California hospitals over this 5-year period of time. And we'll get into that in a little bit greater detail shortly. But I just want to click on a few tabs. The MSDRGs. MSDRGs are a type of categorization that's used for inpatients. And so what they do is they take a combination of the diagnosis codes and the procedure codes, the types of surgeries that the patients have had, and they create these categories. So you can see there's 27 different major diagnostic categories: pregnancy, childbirth, different diseases, etc. And those are broken down into their individual codes and what they call their DRGs. So each one of these rolls up into a particular diagnostic category, which we'll get into details. And I'm not going to go through every tab. You'll get the idea. So let's start with actually navigating through the information space. So I'm going to pick a county in California, and let's just start with Orange County. So I can see these columns are showing me the breakdown by ambulatory surgery volume, by emergency department volume, and by inpatient volume for all the patients or patient encounters for Orange County over the last 4 years. Now I'm just going to click on Orange County, and I want you to watch all the other categories when I click on Orange County. So as I click on Orange County, you can see it now adds orange up here in this box, so I can tell what I'm doing. But this is where the direction or navigation comes into place, because every one of these categories or boxes in every tab has updated to show me the remaining information associated with these patient encounters. So here's the hospital systems that exist in Orange County. Here's the facility names. There's 37 of them in Orange County. And of course, the number of patient encounters by ambulatory surgery, ED, and inpatient volume. And then finally, up here in the upper right-hand corner, you can see we went from 87 million patient encounters down to the 6.1 million patient encounters associated with Orange County facilities. So I'm navigating through my information space. So it's not only changing to show me all the information associated with these Orange County patient encounters, but it's showing me contextually where these patients went. So Hoag Memorial Hospital System had the greatest number of inpatient encounters. And if I scroll down, you can see the type of insurance they have. Medicare and private commercial are about equal. HMO plans are number one. And as I go across, if I click on the patient dashboard, it'll show me all the zip codes in Orange County. actually it's going to show me all the zip codes anywhere in the United States that these patients live in that went to Orange County facilities. So it's going to take a second to update that. And then it's going to show me the cities they live in, the counties they live in, if it's an Orange County, if it's a California county. So you can see here's the zip codes in descending order. So again, that's information. 92804 is the #1 zip code patients came from. And here's the cities. Here's the counties. So you can see that almost 8% of patients that came from Los Angeles went to Orange County facilities. And so let's make this real. Let me focus from a marketing perspective on a particular hospital in Orange County. I'll come back over here to the facilities page, and I'll come down and I'll say, let's just focus on, let me pick a interesting one here. Memorial Care Saddleback Medical Center. So I'll click on that, and now everything's going to update and show me all the patient encounters. Went down to 228,000 associated with Saddleback Memorial. Now what I'm going to do is I'm going to come back over to the patient dashboard, and I'm going to focus on inpatients because I want to put together a marketing program for the inpatient encounters that went to Saddleback. And I want to understand what types of insurance these patients have that go to Saddleback. I want to understand what kind of procedures they're having when they go to Saddleback. And I want to identify what zip codes they're coming from that go to Saddleback for their procedures. And then what I want to do is compare patients from these zip codes and see where else they're going for procedures and what type of insurance they have. So I'll be able to see, okay, here's what Saddleback looks like and what their patient population looks like. And then from the communities that Saddleback services, where else are those patients going? So the idea there is, are there marketing programs that we can put together to try and capture those patients that are leaving Saddleback's primary service area and going to other hospitals? So that's the idea behind this use case. Let me show you how we do it. So I'm going to focus on inpatient encounters. I'm just going to click on record type. 65,000 of them are inpatient encounters. They went to Saddleback. Because this is going to update and show me in descending order of frequency what these zip codes are, I'm just going to pick the zip codes that have the highest number of patients in descending order of frequency that went to Saddleback. And that's how I'm going to identify their primary service area. In this case, there's more sophisticated ways to do it, but I'll leave that for a more advanced class. So in this case, I can see that 13% of them come from this zip code. Another 13% come from this zip code. So right there, 26% of their patients are coming from these two zip codes. But I'm just going to pick these, let's say these zip codes here. And again, everything's going to update, show me the patients that come from this zip code that went to Saddleback as an inpatient. And then I'm going to do one final thing, and it's an important thing to keep in mind when you're doing marketing studies. And that is, I'm going to come over here, and here's the cities you can see associated with these zip codes. I'm going to come over here to the MSDRG tab, and I'm going to remove normal newborns from this study, because what happens is, the mom comes in, she's admitted to the hospital, and then there's multiple discharges, the mom and the baby, or multiple babies if there's multiple babies. So from a strategic planning or marketing perspective, I just want to look at the discharges, the individual discharges. And the reason we remove normal newborns is because they don't really take up much utilization in the hospital. Now, having said that, if the mom has a baby that has other problems, they're not considered a normal newborn, and they have different requirements, and they typically stay in the hospital longer. So we're just going to remove the normal newborns. And the way I do that is I just click this checkbox. It says Start Negations. Then I'll click on Normal Newborns, and you can see up here it now says Not Normal Newborns. So in my little query here, you can see what I've done so far. Now I'll just uncheck that. And we've got all the information we need right here to see what's going on at Saddleback. So I'm going to come over here to the inpatient trends and just take a look at Saddleback. They will be, by definition, isolated because I've already selected them. And this is going to show me the trend for the most recent 3 years, the change in that trend, what we call the case mix index. And the case mix index is an indication of how sick the patients are. The higher the number, the sicker the patients are. So I can see it's a 1.81 case mix index. The average length of stay is how long, on average, these patients, these 37,000 patients, have spent in the hospital in days. And then this is the difference between the actual number of days and what they call the geometric mean number of days. And what the geometric mean number of days is, we compare the hospital's number of days to the average associated with all other patients that went to any hospital in the United States. So in this case, it's 1.1 days greater for those patients that went to Saddleback. And then this is the total number of patient days. So that's, if I added up all the patient days associated with these patients in 2022, here's the days, total number of days. And this is the percentage by principal type of insurance. 7% is Medi-Cal, 61% is Medicare, and 30% is private commercial coverage. So this is telling me that a large number of their patients are probably over 65 because they're Medicare patients, right? And so I can scroll down and I can get a pretty good idea of the patient profile. Here's the breakdown by what we call service lines, or the type of services that they've had. It's, let me sort it in descending order of frequency for 2022. You can see general medicine's number one, cardiac services, pulmonology, etc. And I can see the change in the most recent 2 years. So actually general medicine went down, cardiac went up. If I want to sort by that, I can see which service line went up the most. General surgery actually went up the most. And again, here we're looking at case mix index, average length of stay, the same things. And then as I scroll down, here's more detailed information on the types of insurance. So again, I can see Medicare HMO is number one for Saddleback, etc. But this is where it gets interesting. First of all, what I want to do is I want to create a map of these patients that went to Saddleback Memorial from those zip codes. And I'm just going to focus on the most recent year. So I'll focus on 2022. And I'll come up here and click on this little down arrow, and I can create a map. I'll just create show map. And it's going to open up a map in Google Maps right here. And it's going to color the zip codes, and it's going to show me, where the greatest number of patients came from. So 92630, that's a high number of patients. And if I want to add the hospital marker in, I can see where Saddleback is. It's right here. So you would expect the greatest number of patients that went to Saddleback are in these two zip codes. What's interesting is it's only showing zip codes that are south of Saddleback. It's not including any zip codes up north of Saddleback. Probably is, if you're familiar with Orange County, a lot of this is commercial areas, although there is residential up here. But you can see that Saddleback is grabbing a lot of these patients south of here. And then if I scroll down, and we'll do this again in a minute, here's Saddleback, here's the number of patient encounters from those zip codes, and here's the actual zip codes, the number of encounters from each zip code, the population for each zip code, and the number of encounters per 1,000 population. So you can see by far 92637 has the greatest number of patient encounters per population. So can you get an idea? I'm going to stop here for a second. Can you start to get an idea of why this may be important from a marketing perspective? Does anybody have any questions on anything I've done so far? Cool. I'll just keep going. So the next logical thing to do is to compare Saddleback Memorial to all the other hospitals that received patients from their zip codes. So I'm just going to click this little trash can up here. And what it's going to do is it's going to add all the other hospitals. So you can see that Mission Hospital actually gets more patients from Saddleback's primary service area than Saddleback does. Now that's interesting. Let's take a look over here, and you can see that Mission Hospital actually has a much higher number of Medi-Cal patients, a lower number of Medicare patients. So this is a younger population, more than likely, because it has fewer Medicare patients and also has a higher number of private commercial patients. And as a rule of thumb, when you're looking from a marketing perspective, when you're looking at the type of insurance the patients have or the type of payers, private commercial pays better. So they get better revenue. So because they have a higher percentage of private commercial, that means they're probably getting better revenue. And if I scroll down, now I'm looking across all the hospitals, all the patients that came from those zip codes. And I can see if I, again, sort by general medicine is still number one. Now, in this case, number two is obstetrics. And that makes sense if you think about it, because these patients are skewed towards younger patients, which means chances are there's a greater probability that they're going to the hospital to have babies. So obstetrics is number two. And if I want to focus on any of these, let's say that Saddleback is thinking about expanding their orthopedics line. They've got some doctors that work there, and they're thinking, I want to bring more of my orthopedic patients to Saddleback. Let's find out where they're going and what type of insurance they have. So I can just click on orthopedics, and let's see where they're going for service, what kind of insurance they have. I'll scroll back up here and look at the hospitals. So in this case, the majority of them are going to Saddleback. That's really not surprising when you think about it, because they're principally Medicare patients. So they're over 65. Chances are that population is going to want to have knee replacements, hip replacements, spine stuff. But let's see what kind of, let's just focus on those Medicare patients for a minute. So I can come down here and I can say, okay, let's look at, and you can see the majority of them are these managed HMO plans. I'll just click on that. And you can see how it's guiding me and continuously feeding me more information, right? And I'll say, okay, here's the managed Medicare. And let's get specific in terms of actually what kind of procedures they're having. Because from a marketing perspective, think about this. If patients from and you can see it's 100% Medicare now, patients from this area, I want to know what kind of procedures they have, because I might want to put a marketing plan for total knee replacements or total hip replacements or whatever the number one procedures are they're having. For this, you can see that it's actually spine fusions followed by femur fixations. And then hip replacements are down here. So if I click on that, and you can see the spine fusion. And I'm going to come back and I'm going to adjust this a little bit now that I'm thinking about it. And this is important. The reason it's important is because, and this is what sets SpeedTrack apart, is because typically what happens in a hospital is the service line managers and administration, they meet once a month or so, and they get these canned reports that somebody in IT typically puts together, and they send them these reports, and they look at these reports that are printed out on paper, and they say, okay, I see that, orthopedics are doing this. And then they have 5 more questions, and they want to know more specifics on, what are the procedures, what kind of payers are they, et cetera, et cetera. And they have to say, okay, let's write down this list of questions, and we'll send these questions to IT. And then next month when we meet, we'll look at the new reports, and then we'll have another conversation about it. But SpeedTrack has actually changed that behavior, where in the meetings with all the folks, they can actually go through these scenarios and have conversations about them in real time and collaborate with one another. So everybody can talk and say, well, let's try this. Let's try this. You can see the advantage of doing that. And that's why SpeedTrack has taken off, is the next generation of analytics for healthcare. So let's take a look at this real quick. Let's come back to the inpatient trends, and I'm going to keep on spine, but I'm just going to back out of the payer categories we're looking at just to validate. And then I'll do one other thing that'll be kind of cool. I'm going to back out of managed care, and I'm going to back out of this detailed snapshot. So now I'm looking at all payer types. That come from these zip codes and see where they're going for spine surgeries. So again, it's mission when I'm looking at spine, but let me do one other thing here. If you think about it, one of the limitations I've put on this analysis is these particular zip codes. So let's just focus on all Orange County patients for spine and see where they're coming from anywhere in Orange County and where they're going. And then maybe it'll give me a bigger idea, a broader perspective on maybe some marketing plans we can put together outside of these particular zip codes that we call our service area. So I'll come back over here to the patient dashboard. And I'm just going to remove these zip codes because I've already got all the patients in Orange, or all the hospitals in Orange County I'm focusing on. So I don't care where the patients are coming from. I want to see where they're going for service for these spine surgeries. So I'll just click on the zip code for that. And then I'll click on Orange County patients. So we're just looking at Orange County patients. And then we'll focus on anywhere in Orange County, where are they going for spine surgeries, what type of insurance they have, and is there any kind of an opportunity for us to try and grab these other patients to come to Mission. So I'll click on Orange County. Again, I'm going to get a broader perspective now, and you can see how quickly we're doing this. Typically, this would take days to do this kind of an analysis. Oh, by the way, I'm just looking at 2022. I'm going to expand this across all the years. You can already see that the majority of them are coming from Anaheim, followed by Huntington Beach. This is way outside. These zip codes are way outside of what we called Mission's primary service area. Now I'm just going to create another map. Actually, I'll focus on 2022 again, so we're not the most recent year in the data. And I'm just going to look at another map for this and just click Show Map and see what this looks like. There's still a large number down here in South Orange County, but there's these pockets up here in Northern Orange County. And I'm going to put the hospital markers back in. Let's zoom in a little bit. So I think this is Saddleback. Yeah, there's Saddleback right there. At least, oh, that's a behavioral health site. Treatment hospital, very few encounters. But if I come down, and this is sorted in number of encounters, actually the greatest number is Hoag Memorial for all of Orange County, followed by Kaiser, Providence, Mission, which is right there, right? That's who Saddleback was competing with more than anybody for their primary service areas. Providence, Mission Hospital, UCI, St. Joseph. Saddleback is way down here. So let's see what's going on with these patients. And I can just come back over here to the SpeedTrack application. Let's take another look at these spine procedures. They're all fusions. And if I think I'm still looking at, let's see here. I'm still looking at orthopedics. Yeah, so let's look across all orthopedics. Just to back out. Yeah, it's still spine fusions is number one. So we'll stick with that. And let's focus in on the inpatient trends. So it's kind of like having a microscope, and you can focus in and out on different areas from any perspective you want to and get information that may be valuable to you, right? So again, spine surgery is an ortho procedure. You can see that Hug is going crazy on spine surgeries. And here's Saddleback down here. And so let's go across and look at the payer mix. Again, Medicare is number one, but Hoag has a higher percentage of private. In fact, Providence Orange has a much higher percentage of private and a much lower percentage of Medi-Cal. So you can see the balancing act that's going on here in terms of principal types of payers, et cetera, et cetera. So, oh, this is another interesting thing. Cal Optima is the number one health plan for HMO by far. So you can see how you can gather, and Medicare traditional coverage or fee for service is number one too. That's an interesting piece of data. So I could go on and on with this particular use case, and I want to open it up for questions, and feel free to chime in, Linda, if you have any comments from your perspective.
I sure will. Come on, kiddos. Let's ask him some questions. This group is a little quiet in the mornings.
That's
but,
understandable. I get it.
Let me see. I've got one I can usually pick on. Danny, don't you have any ideas about this?
Honestly, this is all new to me, so it's actually not something I'm very familiar with. I'm definitely interested in all the data analyst stuff because that's actually something I want to get into. So I guess one question I have is, what's the easiest way to get into it other than taking the 416 class, which I've taken already? Is there an easier way to understand the process and how to do all these things?
Yeah, well, that's really Linda can tell you that. I don't have the ability to add users to it, but you know, Linda, if there's a way to add Danny or other students so they can get in there and play around with it. And by the way, Danny, I should have pointed this out earlier, but if you come up here to the help page, here's no, that's not what I'm looking for. I thought we added the help thing here. Oh, no, there should be a report thing here. I'll make sure it's added today, but it's instructions on how to use the application. I'll make sure that's added here today. This is a pretty new application that we created for CSULB. So, wow, I'm surprised that's not in there, but it'll be added today, and you can go through and it shows you how to do everything I'm doing here and more. And if you do get access, feel free to reach out to me. And if you have questions, I'd be more than happy to get you the answers you're looking for.
Are there any other types of software like this that we should be aware of and possibly
Sure.
use in the future?
Yeah, there's competitors with SpeedTrack, obviously. Let me think of a couple of them. A lot of hospitals, what they do, if you're familiar with Tableau, by the way, this data set is available to all hospitals for free. We do have an advantage there, a couple of advantages. One is where I'm not showing you that here, but the state, this is available through the state. So let me back up a little bit. The state of California requires every licensed hospital in California to submit their data to the state for emergency room data every quarter and for inpatient data every 6 months. And then what the state does is they aggregate all that data, and then they make it available back to the hospitals for free. But it's over a year before they make that data available back to the hospitals. So, for example, the 2023 data hasn't been released yet. It should be released in the next month to 6 weeks for the hospitals. SpeedTrack actually has an advantage there because we have a relationship with the Hospital Quality Institute, which is part of the California Hospital Association. And through that relationship, the hospitals that submit their data to the state actually make a copy of the data and submit it to the Hospital Quality Institute at the same time, because of SpeedTrack's relationship, we get that data. And so we're actually hosting data through the second quarter of 2024 now, where the state hasn't even released the 2023 data. So all other competitors outside of SpeedTrack still don't have the 2023 data yet. Now, having said that, you asked about who they are. What a lot of hospitals do is they go ahead and get the data from the state, and then they use an internal system, like they license Tableau is a very popular one, various visualization and analytics systems like that, or they'll use SAS to do statistical analyses. The problem with those applications is they're confined. So whoever designed the Tableau dashboard for people to use, they're just confined to the elements, the data elements that they put in that Tableau dashboard. SpeedTrack, we show every data element from every field in the dashboard. So you can do any kind of analysis you want if you can click a mouse. In addition to that, what we've done is we've integrated a lot of data from other data sources beyond what the state provides. For example, we provide integrated data from CMS. We provide integrated data from the US Census Department. We provide integrated data from HRQ, which is a national quality institution for hospitals. And we get information there, for example. Oh, we also integrate an algorithm from New York University, which I haven't even got into. So we have a lot of additional applications, but Tableau is one of them. SAS is one of them. There's also a direct competitor with SpeedTrack. There's a couple of them. One's called SG2. They're about 10 times more expensive than SpeedTrack. Another one's called Trilliant. The advantage that Trilliant has is they also have physician information in the data. We don't have that, which is extremely valuable. That's something I'm trying to get my hands on, but that data is very expensive. So a lot of our customers have both Trilliant and SpeedTrack because we can get to more granular information more intuitively and quickly. And then they can take what they learn in SpeedTrack if they have the budget and look at the same stuff in a Trilliant. Another one is called Truven, which is an IBM product. Frankly, we've taken a lot of their customers away because we're a lot easier to use. And again, we provide access to more intuitive information that's particularly valuable for strategic planning and business development. But those are a few. There's others, I think, that are out there. Frankly, our biggest competitor is the hospitals themselves. But once they see what we're doing, they realize that it's a lot more cost effective just to subscribe to SpeedTrack rather than to license SAS or shoot, what's it called that I said a minute ago? Okay, it'll come back to me in a minute. One of those other programs. So yeah, there's competitors. We have a different perspective and how we work than they do. And it just kind of depends on what the various hospitals value. But does that answer your question? I'm open to follow-up questions.
Yes, it answers my question. Thank you.
By the way, Tableau was the other one. And Tableau is very popular. They're just very expensive. And the individual hospitals have to configure them themselves, where we have everything in one. You just subscribe to it. It's all configured. You just start using it. And it comes with unlimited training and support for the application. You know, I think there's some other stuff in here. Let me see. Maybe not. Oh, here we go. Okay, cool. No, that's stuff we've already talked about. Any other questions, or Linda, is there any particular use cases that you would like me to expand upon before we call it a day? We're almost to the end of the hour.
Well, I would, I'll comment about what you said about the hospital having to create their own software, to sit on top of that. Years and years ago, when Oracle first came out, my older brother was a data person, Fortran, and he told me that I should learn how to do the GUI pages, which is what basically y'all are doing. It's not the term that's used now, but you know, where you do it for somebody and kind of like SPSS, and then you just have to go in and click on it. And I think that is the best thing since I don't know what, you know, because to have to go in there and program it is time consuming and money intense. You know, it's better to get it from somebody like y'all that have already done that kind of work, you know.
Yeah, that's an advantage we have over the Tableaus. Because like I said, inevitably what happens is they configure a dashboard and then somebody wants to see other things in the dashboard that they didn't originally configure. And it's, and by the way, this is configurable. So I didn't show you that stuff. If I wanted to do, let's say, a more in-depth analysis by service line, I can just come over here. There's the service line tab, RGs. And let's say I wanted to look at service lines by length of stay. I wanted to create a tab. What do I got here? I'm going to unclick Spinal Fusion. Just come down here and clear that selection. So I'm looking across all service lines now. And I wanted to make this a table. So I'll come up here to display type, list, and I'll just add a column here for, I'll add a couple columns. Let's do that. I'll come up here to manage columns. And I want to add a column for average age of the patients for each service line. For some reason, this is taking long. Like I said, this is a new release, and we do have some bugs in it. But this should just show the age column right here. Let me try something.
You know, years ago when you first started speaking to when I had face-to-face classes, the graduate classes, and you did something with them. I don't think you did quite the same thing today, but you showed them like someone asked how you would judge, how you would use it to help staffing purposes, you know, and I remember you used an example of the number of people that were admitted to, I think it was one of the downtown LA hospitals, and with stab or other types of wounds on New Year's Eve. And I thought that was real interesting.
Yeah, I sort of remember that, and we can do that with this one, although I'm not going to have time to do it today.
Right. But I thought that was, you know, because then you said, well, and the way you approached it was that, you know, the emergency room needs to have more people working that night, you know, or whatever it was. But I thought that was
Yeah,
really
we did something similar actually for one of our customers a couple of years ago. And they actually wanted to look at ED shootings within LA County and where they were going. Not exactly for staffing reasons, but they were doing it for more of a public health reason. So they wanted to see, oh, there we go, average age. I'm not sure what the deal is here. So let me just add average age. But yeah, we could zero in on where shootings were happening and where they were going for EDs and look at, you know, all the characteristics associated with that.
Which I think is incredible, because something like that those stats can be moved forward into other things besides healthcare, you know, like into the police records and, you know.
Well, one of the things I didn't mention earlier is we actually also have law enforcement for customers. We have a separate application we built specifically for law enforcement. And the interesting thing is it's very similar data. I mean, if you think about it, yeah, and one of the things I'd love to do at some point is to integrate the law enforcement data with the healthcare data, because I think it would really help public health to really, because there's a lot of overlap and correlation, particularly with ED visits. So I think it would be valuable to do that, but it's politically difficult.
Yeah, I could see how it'd be really valuable, that there'd be a lot of crossover, you know, if you're looking for stats on particularly, you know, injuries that end up in the hospital, you know, that start out with the family disturbances, you know, so.
You bet. Mental health is another one. And that's a big deal today, as you can imagine. So yeah, I think that does it for me today, guys. Is there any final questions before we sign off?
We really appreciate you. Thank you so much. And I hope I will see you tonight at 7.
I'll be there unless something drastic happens, but yeah, I'll be there, Linda.
Okay, super.
Thank you, everybody.
It's
Have a
been
great
very
day.
informative. Thank you.
You bet. My pleasure. Bye-bye.
Bye-bye. Okay, I always love to have Jeff come speak to us. Some of you will be using that program, and actually I believe it's available to most students. I don't know exactly how you are able to access it if you're not in one of those classes, but those teachers know. We spent the department spent a lot of money to get them to do that, have that available to y'all, because it's so useful for you once you get out in the working world. Okay, so got a few things, little catch-ups to talk about. First off, there's been some scuttlebutt about students that are not having time to meet with the groups. And, you know, I gave you all time off, and then you have time off on most Thursdays that everybody should be available. So please make use of that. And if I get information from group members that someone is not participating, I have no problem with grading individually. I shared with a student the other day that when I was in graduate school, other students always wanted to get into my group because they knew I was going to do it if they didn't do it, because I wasn't going to let them make my grade suffer. And that's how a lot of you are. And I vowed right then and there I was not going to allow students, if I knew about it, to get away with not doing their share. So please, please, please stay in contact with your group and do your share, and be available if, to chat, or because everybody should be available on Tuesdays and Thursdays from 8 to 9:15, period. Next announcement, there is that extra credit for y'all to go to on Thursday with Dr. Ramirez, and the showing of the about service dogs, and there's going to be snacks and drinks and all kinds of things, and I think it'll be really interesting. And so please try to go if you're on campus or can get on campus to see it. I sent y'all an email out about it. And we don't have class next week, but that doesn't mean you don't need to meet and get together. I don't want to force y'all to come to class, to force y'all to be in the groups. I feel like y'all are all adults and when you're available. So, be sure that y'all get together. I extended your proposal due date because people, and it must have really been needed, because I only had a couple say they had problems, but none were turned in. So I know y'all are all still working on it. Right now it is due tomorrow night by 11:55, but I think I'm going to extend it to Thursday, and Thursday night. Now that's going to put me in a little bit of a crimp because I have to get them graded and turned around back to y'all fast so that y'all can do the final copies. But I will, try to get that done really quickly. And if I have to extend it, the other part, I guess I will, but I'd rather not. So, because I'd like for y'all to have it turned in before the Thanksgiving break, but if we have to extend it, we will. But right now, I'm going to extend the proposal until Thursday night, and that will give y'all Thursday, 8 to 9:15. Everybody should be able to meet to finish it up, and then that's the dead last time you can turn it in is by 11:55 on Thursday, and I'll send a message around about that also, an email. And let's see what else. I'm going to, because of all the extensions and stuff, I'm going to cancel class on the 19th with the provision that y'all are to meet on that day via however y'all normally get together. And get that project ready so you can get it churned out. So I believe it's the 19th. Let's see. So we don't have class next week. You will, and then the next week I'm going to cancel class so y'all can work on your projects that week, 19th and the 21st. You will still get credit. You'll still get the 2 points unless I hear from their group members that you didn't show up to your meeting. So I will send an email out about that also. Now, before I send you off into your groups, do I have any questions? You know, y'all are really a great class. Y'all come to class and y'all turn your stuff in, and you're really, you know, but I have no way of knowing because I'm not like, you know, a fly on the wall when you're having your group meetings. Unless y'all tell me something's going on, I have no way of knowing. So please, please, please work together as a group. You're going to have to be doing this once you graduate. And believe me, you're going to be in groups that you won't really care for the people you're in the group with, but you won't have a choice, you know. So you need to learn to work with everybody for these groups and get things done. Okay, questions? Anybody? Comments? Okay, I'm going to open the groups for y'all, the breakout rooms, and I will bring y'all back in at let's see, 9. You know what? No, I'm not going to bring y'all back in. Y'all just, when y'all get through, y'all can go. But I'm going to be checking to be sure that y'all don't go to your group, because you've got time now to make the adjustments to the proposal. And I'm here to answer your questions. So y'all can now go into your rooms, and I'm available to answer any questions you have. Chandra, you there? Jamie, you there?
Yeah, I'm here.
Okay. Do you know which group to sign yourself to?
Yeah, my Wi-Fi is just going slow, sorry.
Oh, that's okay. I'm just checking on you.
Oh, thank you.
Okay, you want me to send you there?
Yes, please.
Okay, what group number is it?
It's 4.
Okay.
Thank you.
Oh, you're gone. You went already. Okay.